Good morning. We are back out on location. You might recognize Dr. Mackay here. Of course, Dr. Mackay, vein and circulation specialist. We're in his location in St. Pete, one of 3 locations here in the Bay Area. And this morning we were talking with Dr. Mackay. We're going to make you feel a little uncomfortable a little bit, talking about yourself. But this is so important because I think especially when you're trying to find a doctor, trying to find a specialist and getting something done, a procedure done, you really want to make sure you're going to the right doctor. This is what you specialize in, veins, circulation. Tell us a little bit about kind of your background, your experience.
Well, I'm a board certified vascular surgeon. That means that you specialize in the venous field and arterial and venous, but I've narrowed it down to primarily venous. Now we end up seeing a lot of arterial patients because sometimes it's hard to differentiate where the symptoms are coming from, but the vascular surgeon is the one that specializes in the peripheral vascular.
Why is that important, do you think, for patients to know that they're making sure and going to a doctor that this is their specialty? Because I'd imagine there are a lot of choices these days.
Well, yeah, there are people that dabble in this field and don't have training at all, maybe taken some classes or courses, but aren't really trained in the field, so they really don't have experience, and I think that's what it really comes down to, is just having a lot of experience in treating these problems and having a broad range of knowledge in the circulatory field, which a vascular surgeon has, but then also can narrow it down to the venous component as well. Well,
and speaking with you so many times now, I've learned about that you're doing procedures that are everyday procedures, and then also looking to the future of what this care is as well, and kind of being able to see where it's going to work, where it's not going to work. Correct?
Oh yeah, there's new techniques coming out all the time. And I was able with a group to be some of the first to do VenaSeal, which is a cyanocrylate glue that we use to treat that doesn't require as much numbing. It's a very painless procedure. And that is recently FDA approved. The insurance companies aren't covering it yet, though. But it's exciting, as there are several new ways now that we can offer this with almost just very minimal anesthesia requirement, local anesthesia requirement. People just a little bit of numbing, but that's about it. And the insurance companies are a little slow to pick up on some of the new ones, but the tried and true ways are still there, and where you have to be very numb, but it works very well.
Speaking of tried and true, I don't want it to age you, but how many years have you been in this field?
Well, I've been doing vascular surgery for 25 years or so in practice, but specialized in veins for right at 18 now.
So much so, you're actually training other doctors, correct? Tell us about this conference that you're a part of.
Yeah, I'm a co-director of the International Vein Conference, where we have about 700 or 800 physicians attend a year, and we bring in experts from all over the world. And then myself and the director, Jose Almeida, and I do live cases in front of the doctors, spend a full day just doing that, so they can watch us do these different techniques.
Well, and again, when you call the office, consultation, I'd imagine, is probably one of the first steps, but you see Dr. Mackay. You were the one doing these procedures.
Yes, yes.
Which is important to note.
If you have varicose veins and that kind of thing, they'll make sure you see me, and we can decide what needs to be done.
You are the specialist. That's who we want to see. Doctor, thank you so much. It's always a pleasure talking with you, getting a little educated on some of these areas that we're not too familiar with yet. If you have any questions, he would love to have you give one of their 3 offices a call, and they've got a great website as well, and we look forward to seeing you soon.
Well, thank you.
Our website, tbmorningblend.com as well. We'll have more info too.